tonight, as promised, a special comment on health care reform in this country, and in particular, the public insurance option. In March of 1911, after a wave of minor factory fires in New York City, the city's fire commissioner issued emergency rules about fire prevention, protection, escape sprinklers. The city's Manufacturers Association in turn called an emergency meeting to attack the fire commissioner and his interference with commerce. The new rules were delayed. Just days later, a fire broke out at the Triangle Shirtwaist Factory. The door to the fire escape had been bolted shut to keep the employees from leaving prematurely. 150 of those employees died, many by jumping from the 7th floor windows to avoid the flames. Firefighters setting up their ladders literally had to dodge the falling, often burning bodies of women. This was the spirit of the American corporation then. It is the spirit of the American corporation now. It is what the corporation will do when it is left alone for a week. You know the drill. We all know the drill. You get something done at a doctor's, at a dentist's, at an emergency room, and the bills are in your hands before the pain medication wears off. And if you're one of the lucky ones, and you have insurance, you submit the endless paperwork, and no matter whether it is insurance through your company, or your union, or your nonprofit, or on your own dime, you then get your turn at the roulette wheel. How much of it is the insurance company going to pay this time? How much of it is the insurance company about which you have had next to no choice and against which you have virtually no appeal? How much is this giant corporation going to give you back? What small percentage of what they told you they were going to pay you will they actually pay you? You know the answer, and you know the answer if you don't have insurance. But do you know why that's the answer? Because the insurance industry owns the Republican Party. Not exclusively. Pharma owns part of it too. Hospitals and HMOs another part. Nursing homes, they have a share. You name a Republican, any Republican, and he is literally brought to you by campaign donations from the health sector. Senator John Thune of South Dakota, he gave that Republican rebuttal to the president's weekly address the day before yesterday. He said the Democrats' plan was for, quote, government-run health care that would disrupt our current system and force millions of Americans who currently enjoy their employer-based coverage into a new health care plan run by government bureaucrats. That's a bald-faced lie, Senator, and you're a bald-faced liar, whose bald face happens to be covered by your own health care plan run by government bureaucrats. Nobody would be forced into anything, and the public insurance option is no more a disruption than is letting the government sell you water and not just Poland Spring and Sparklets. But as corrupt hypocrites go, Senator, at least you're well paid. What was that one statement worth to you in contributions from the health sector, Senator Thune? $5,000? $10,000? We know what you are, sir. We're arguing about the price. What about your other quote? We can accomplish health care reform while keeping patients and their doctors in charge, not bureaucrats and politicians. Wow, Senator, this illustrates how desperate you and the other Republicans are, right? Because, Senator Thune, if you really think bureaucrats and politicians need to get out of the way of patients and their doctors, then you support, obviously, a woman patient's right to get an abortion. And you supported Michael Schiavo's right to take his wife off life support, and you oppose bureaucrats and politicians getting in the way, and we'll just mark you down on the pro-choice list. That's a rare misstep for you, Senator Thune. No $12,000 payoff for that statement. I'm not being hyperbolic, am I, Senator, about the money? Senator Thune has thus far received from the health sector campaign contributions, and all these numbers tonight are from the Center for Responsive Politics. Campaign contributions amounting to $1,206,176. So much for Senator Thune. How about Congresswoman Ginny Brown-Waite? Good evening, ma'am. You are the Florida representative who claimed on the floor that Democrats had, quote, released a health care bill which essentially said to America's seniors, drop dead. Now, those are strong and terrorizing words. That's exactly what your insurance and medical overlords wanted to hear. But are you truly worth every dollar of the $369,255 of them you have received over the years from the health sector? I'd read the rest of the operative part of your great speech myself, but your rendition actually cannot be matched.
Listen up, America. Seniors have special needs. This bill ignores the needs of Florida's healthcare system. We should be fixing what is broke, not decimating the care of our senior population.
You can always tell, can't you, Congresswoman, when the hostage is reading her own ransom note and when she is reading one written for her. So much for Congresswoman Brown-Waite. There's so many other Republicans bought and sold, like that unfortunate congresswoman there by the health sector. Minority Leader McConnell of the Senate, You're worth $3.1 million to the health sector, $1.5 million just for last year's election, and I'm supposed to think you aren't a sellout, a liar, a paid spokesman, a shill, a carnival barker? So much for Senator McConnell. Congressman Joe Barton of Oklahoma, $2,660,000, Congressman? That is 10 times what Senator Robert Byrd has accepted from the health sector. Congressman, what a guy. So much for Congressman Barton. Senator McCain, $1.6 million to serve the hospitals and serve the drug companies and serve the nursing homes and not to serve the retirement communities of Arizona or the cancer survivors or the veterans. So much for Senator McCain.